Healthcare has always been a point of interest throughout time and across cultures. Different forms of health practices have been well recorded across time in medical journals, images, diaries, and professional documents. Stereotypically, Western thought tends to view healthcare on a trajectory of improvement, wherein new advancements are always seen as an improvement to older medical practices, and traditional and professional forms of healthcare are seen to never intersect.
You wouldn't believe how much worse it would have been even a few years ago.
This might hurt it a little.
Look, milady, I know it stinks that we're removing your foot and plan to eat it tonight at the healing feast, but you wouldn't believe it how much worse this would have been even a few years ago.
Jokes aside, in spite of this perceived separation between traditional and professional medicine, these two fields often intersect, especially in times of transition. These forms of healthcare further interact on planes of race, class, and gender, and consist of varying degrees of conflict and cooperation. My current interest in healthcare focuses on these atypical experiences. My research will seek to discuss the intersection between professional and traditional forms of medicine and its interaction across race, class, and gender in New Mexico. So why New Mexico? In previous facets of my research, I found a deviance in the treatment of traditional midwifery in northern New Mexico when medicine in America was being professionalized. Essentially, due to numerous factors, such as the remote locations and inaccessibility of northern towns, the lack of professional doctors to cater to a spread-out population, the cultural divides between generally Anglo-American doctors and a primarily Spanish-speaking small Hispanic community, the inability for many families to pay for professional medical services, and the already established presence and reliance upon a Hispanic traditional midwife, or partera, the public healthcare system in New Mexico had to train and rely on these traditional healers in order to support small Hispanic communities. This effort to utilize as opposed to eradicate traditional healers, in part, is due to a public health effort to reduce maternal and infant mortality rates. This relationship further allowed parteras to continue their traditional practices, albeit through certification and training provided primarily by nurses in the public health system in New Mexico. Not only were parteras given new knowledge and tools to take care of their patients, they were also connected to a larger healthcare system to ensure the safety of the mothers and their infants. In other areas of the United States, professional medicine sought to hinder or halt traditional forms of medicine, and traditional midwifery was not usually considered a valid form of healthcare. New Mexico's different approach actually worked to their advantage. Maternal and infant health improved drastically. In 1935, when the program was first getting started, infant mortality was at 125.8 deaths per 1,000 births. By 1955, that number decreased to 43.6 deaths per 1,000 births, a significant change over a relatively short period of time. While the use of traditional midwifery did decrease as we approach modernity, primarily due to new access to healthcare services, New Mexico still continues to follow a legacy supporting the work of these traditional healthcare practitioners. The University of New Mexico actually continues to have a certification program for midwives. This presence of midwives in New Mexico remains strong, even if some of the more cultural aspects of parteras have been lost. Either way, I intend to investigate this interaction of traditional and professional medicine in the 20th century, not just with Hispanic communities, but Native American communities as well. Although my research is still in its relative infancy, I plan to see how these health practices and interactions impacted and reflected racial and gendered relationships in a larger New Mexican context.
storming the castle.
Think it'll work?
It would take a miracle.
Bye-bye.